welcome our last presentation, entitled Insomnia and Menopause, Review on Mechanisms and Treatments, presented by Mrs. Austėja Malinauskaitė.
Hello everyone. Today I would like to present the review of insomnia and menopause, review of mechanisms and treatments. The menopausal transition is associated with an increased frequency of sleep disorder. Insomnia is the most common and recognized as the main symptom of menopause. Understanding sleep complaints in menopausal women in an emerging area of clinical and research. Several recent studies have focused on menopausal insomnia and its mechanisms. However, there are still no clear treatment guidelines. The PubMed research in 2005 papers after duplicate removal. Total of 10 papers were included in this review. So results. Various predisposing factors, persistent past insomnia and aging increase the risk of insomnia during menopause. Various factors stimulate its occurrence during menopause. Hormonal changes can cause insomnia during menopause and later. An important role is played by psychological changes, decreased secretion of melatonin, and disturbances in the circadian of solar system. Menopausal transition symptoms hot flashes, night sweats, mood disorders, and other sleep disturbances are also important. Benzodiazepines remain the mainstay of treatment. Benzodiazepine hypnotics and the never agents, zolpidem, zopiclone, and zaleplon, are preferred over barbiturates. Using antidepressants and in the absence of depression is not recommended, but antidepressants such as SSRI appear to be effective. There is currently a lack of concrete evidence for hormone replacement therapy. Finally, given its good tolerability, safety, and efficiency, extended release melatonin should be the first-line treatment for women more than 55 years of age. As a non-pharmacological method of treatment, cognitive behavioral therapy is effective. Complementary and alternative therapies, yoga, massage, exercises may be useful and adjuncts, but have not been yet shown to be effective as stand-alone treatment. So in conclusion, the etiology of insomnia during menopause is multifunctional. Medical treatment usually involves benzodiazepines, in some cases antidepressants, and extended-release melatonin. Non-medical treatment is cognitive behavioral therapy. Thank you.
Great work. Now, do we have any questions from our judges on the site?
Or any questions from our judges in online platform?
I'm sorry, but sometimes maybe I cannot catch up what you try to explain. So could you explain in detail about the methodology that you use? For example, the database. I saw in your poster that you use the PubMed. And then what is the inclusion-exclusion criteria? And what kind of study that you included?
Yes, we did the research of PubMed. The study is over 10 years from now. So I don't know, I don't get the question maybe.
What were the inclusion and exclusion criteria that you used?
Oh, so the inclusion criteria, firstly, was 10 years old studies, not older. the language should be English. Also, there is the free articles, which was just can be reached for us. And the exclusion criteria is women without the menopause, also women without the insomnia symptoms. I don't know, older than 10 years old.
Thank you.
Thank you. Are there any more questions from our judges?
Okay. I would like to ask you whether you include both human study and non-human study.
Also the human study.
Only in human study, right?
Yes.
Okay. What was
Yes.
the common study design they were using?
Can you repeat the question?
What was the common study design that the studies are using?
Clinical researches, meta-analysis, and one systematic review.
Okay, so you included previous systematic review as well, right?
Yes.
Okay, thank you.
Thank you. Are there any more questions? Thank you so much.